Good afternoon, everyone, and welcome to this webinar presented by the Canadian Partnership for Women and Children's Health. Before we begin, we ask those joining by phone to please mute your line. We have invited CanWaCH members to join us today so that we may share the findings of a research report commissioned by CanWaCH earlier this year titled Using Shared Values and Beliefs to Engage Canadians. The report is a major study of Canadians' understanding of and attitudes towards investment in women and children's health globally. It follows similar research CanWaCH conducted in 2015 and therefore also offers insights into the trends and shifts in Canadians' values and beliefs in this area. These findings will help to inform how and where CanWaCH and its members can most effectively engage with the Canadian public in the months and years to come. We officially released this report on August 10th in both French and English. It is available for download through the link in the dialog box at the top of your screen in this webinar or on the CanWaCH website, www.canwatch.ca. We would like to thank National Public Affairs and Ipsos, the firms that conducted the research and analyzed the findings in both 2015 and 2017. We are joined today by Grace Tong, Director of Public Affairs for Ipsos, and Carolyn Santolin and Michael Mahoney of National Public Affairs. You'll note on our agenda that today's webinar will include a brief overview of the research. We will then provide you with the background and methodology for the research, run through key findings, including insights into key Canadian audiences, and we'll wrap up with the report's recommendations before providing you with the opportunity to ask our presenters questions. Those on the phone will have the opportunity to unmute your line to ask questions at that time. Those joining on their computer may post questions in the chat pane. A reminder that today's webinar will be recorded and posted on CanWaCH's YouTube channel. We are also joined today by CanWaCH's Executive Director, Helen Scott. And before we dive into the research itself, I am pleased to turn the mic over to Helen for a few words.
So thank you to Charmaine for leading this webinar and bringing us all together, and of course for her leadership on the project overall. I'd also like to thank others who've been involved in this important initiative. So first, National and Ipsos have been strong partners of ours for a couple of years and have really done a lot of great thinking and applied some good methodology to generate this report, which I think will be quite foundational for our work going forward. I'd also like to acknowledge the CanWaCH board. So our board has strongly thinks that collectively the CanWaCH members can accomplish something pretty neat if we work together on public engagement. So they've been quite valuable in this project, and I'd like to acknowledge David Morley, who's quoted here on this slide. David is the President and CEO of UNICEF Canada and also the chair of our board. And then finally, and I think most importantly, thank you so much to all of the CanWaCH members who continuously just engage with us, with the Secretariat, and with each other in what I think is just a really unique partnership. There's a real sense of a shared mission here for women and children, and it's always my pleasure to work with all of you. Particularly would like to acknowledge the Public Engagement Working Group, the newly formed Public Engagement Working Group, many of whom are on this call today, so thanks to you for the work that you're doing, that you have done today to pull us together, and thanks in advance for the big project that we're going to be undertaking together in the days to come, or the months to come, sorry. So we think this is a pretty critical time for the sector. The government has launched the Canada's Feminist International Assistance Policy, and this is a great time for us to start to think about how do we best communicate this work with Canadians. We want to be able to demonstrate the unwavering commitment of our CanWaCH partners and CanWaCH members for championing the health and rights of women and girls. And what we ideally would like to see and what we would like to accomplish is that we can empower Canadians to share in that mission. So this report follows a report that research methodology that we conducted in 2015. So as Charmaine just mentioned, it actually allows us to see some trends and shifts in Canadian values over the past couple of years, and we hope to be able to use this as a foundation to assess our impact as we launch a public engagement initiative. And it, as Charmaine mentioned, it explores ways that we can engage with Canadians both online and offline. It also talks about how do we need to How do we need to talk to Canadians? What's the language that we're using? What are some of the ways that we can communicate this work that they can understand and grab onto, and avoiding some of the jargon that we all tend to use in this sector? So really interesting insights there. I think this report reveals some intriguing and, for me at least, some surprising challenges. But it also uncovers some really important opportunities. And I'm really excited to have the CanWaCH team in place to help execute this, the public engagement work in place, and our members' commitment, and looking forward to what we're going to accomplish together over the next couple of years. So with that introduction, I would like to invite Grace Tong of Ipsos to share with you the background and methodology of this research report. So over to you, Grace.
Hello, everyone. I just want to make sure that everyone can hear me. I'm just hearing sounds on my side, so I'm assuming that I'm clear on everyone else's side. Thank you very much for having us present this today. I'm very excited about this report and about the tracking results from this study. We'd actually conducted the study in 2015, as Helen had mentioned. And in that study, we'd actually also conducted a robust segmentation to validate the segments that were identified in the digital ethnography that Michael Mahoney from National PR will be taking you through. This year, however, we did have a couple of additions to the survey questions. In addition to asking about maternal and child health, we also asked more broadly about women and children's health with a focus on sexual and reproductive health, and basically this is actually to reflect a global shift in the lexicon, in issues around maternal and child health. In addition to asking about social media, we also asked about consumption of news in social media. So it gives you a little better understanding of how Canadians are consuming their news, particularly through social media and through which sites. The survey itself was conducted in the beginning of May this year, which is similar to the time frame that we conducted it 2 years ago. And it was conducted among Canadians, a nationally representative sample of 18 years and older. And the data was weighted so that it was actually reflective of the population characteristics by age, gender, and region across Canada. Following this, Michael Mahoney will take you through the belief-based behavior, which was the digital ethnography, and he will go through the target segments specifically. Sorry, I'm just getting used to this technology. 1 second. Okay, I'll take you through some key insights and findings. The first one is identifying priority global issues among Canadians. There's a fundamental disconnect. Overall, since 2015, there's actually been very little difference in what Canadians are seeing as the global priority. Climate change still ranks top, and women and children's health specifically ranks lowest, among the lowest among all the issues that we had named. Lower than climate change, global economic stability, poverty and hunger, and even gender equality as well. In the data itself, as you can see, between 2015 and 2017, there's been no change across the importance of different issues, with the exception of climate change. There's been an increase by 5 percentage points in 2017, with 40% saying climate change is an important global issue. When you look down to 6th and 7th ranked place here, women, adolescents, and children's rights to sexual and reproductive health in developing countries, 9% say that that should be an important focus for Canada. And below that, actually it's on par, is the health and well-being of mothers and children in developing countries. 1 in 10 say that that is an important global focus for Canada. Importantly as well, quite differently than I think the Americans at this particular point, 2 in 10, 21% are saying that no, we shouldn't be focusing on global issues at all, we should really be focusing on domestic issues. Attitudes about international development. Again, we didn't see a whole lot of change when it came to attitudes about overseas development aid, or ODA. We continue to see it as Canada's duty to provide support for issues related to global poverty, education, maternal and child health, and so on. However, fewer Canadians believe that Canada is actually falling behind other countries. They think we're doing enough. And in fact, we haven't increased funding in this area. So it's important that this is all about perceptions, what Canadians are seeing or thinking. So just taking to the actual data itself, 64%, as in 2015, believe that Canadians will have a duty to support the improvement of health, education, and economic opportunities for the world's poorest people. 30%, 3 in 10, which is similar to 2015, also say that we should strive to increase the amount of foreign aid we give, regardless of the economic situation at home. However, what we do see is a fall in percentage of people saying that Canada is falling behind other countries in how much it is doing to help the world's poorest people. It's an interesting finding because this is all about perceptions, because as I said earlier, we haven't necessarily increased funding. However, I think compared to what's happening in the U.S., people are thinking that Canada is doing much more. Another key finding is that civic engagement in activities like volunteering, donating, and participating in fundraising activities has actually slightly decreased. However, what we did see was higher engagement in social issues online. So when you think about the, I'm sorry, I forget the acronym, the ASL challenge with a bucket of ice. When people think that, you know, they dropped a bucket of ice on their head, they did something to support a cause. So people are turning more online and thinking they're actually doing something for the causes that they believe in. What we see here in this slide is that donation to charities has dropped by 4 percentage points since 2015. Volunteering has also dropped. Actively participating in fundraising activity has also dropped. And overall engagement has dropped to 68% in any one of these activities listed versus 73% in 2015. What we see in 2017 is actually an increase in what people are doing online. So there are more people reading what others have posted online regarding social issues, and there are more people actually commenting online regarding social issues as well. The next key point is awareness of Canada's role in ODA, and also not having knowledge of this, what is the impact on their pride in Canada. 6 in 10 Canadians say they feel a sense of pride in Canada's role, and this is significantly higher than 2 years ago. It's 59% versus 52%. We know that Harper had started this initiative. So the fact that more Canadians are aware, we're actually attributing to what we're calling the Trudeau effect. And this is actually quite interesting because there's definitely a Trudeau effect that we're seeing in our other data as well. We have a contextual study that we run monthly, and what we've seen since the election in 2015 is that there's been a 10 percentage point increase in Canadians feeling that they are overall satisfied with Canada and what's going on in Canada. And again, that is the Trudeau effect. So there's, you know, in contrast to what's happening, as we know, in the U.S. With Trump, who was actually mentioned in open end, what we're doing in Canada and Trudeau's policies are having a positive effect on how Canadians are feeling about their country. We also asked Canadians about how they felt about the issue of women and children's health, specifically how interested they were in the issue. And this year, compared to last year, we provided them with a little bit more knowledge about women and children's health. Specifically, actually, let me just take you through this slide. The proportion of those who are aware, this is 25% who say yes this year versus last year, which is 21%. And this year is 59% versus 52% last year. So just going back to our previous point, interest in the issue of children, women and children's health. We also see an increase here, 70% versus 63% in 2015. We attribute this increase to actual more information that was provided this year compared to the 2015 study. In the 2015 study, we asked the same level of interest question, but we had asked them more broadly about maternal and child health and about malnutrition and birth complications, disease and mortality rates, and so on. This year, we gave them a little bit more information, specifically about sexual and reproductive function, and also about inequitable access to health services to address women's needs. The fact that they have fewer rights, little independence in deciding on the timing of birth and use of contraception, and they are higher risk of gender-based violence. So armed with this information, there has been an increase in interest in this particular issue. And I think that's a really important point to take away from the research is that there needs to be some information, some facts, because simply stating broadly about maternal and child health is a little bit too broad. People can't grasp onto that general information. And specifically when looking at demographics, not surprisingly, women are more interested in this key issue. And also, very importantly as well, is the 18 to 34-year-old demographic. 77% of 18 to 34s or millennials are interested in the topic versus 67% of those who are in the older age groups. Another interesting finding as well that came across in the 2015 study too was that those in Quebec are more interested than those in the rest of Canada, specifically in Ontario. I know that the NGOs are often very interested in this question. We asked, which organizations are you aware of that actually support ODA in mothers, women, and children's health? And the most important finding was that 64% of Canadians could not name one organization that works in this sector. Specifically, when we did ask to name an organization, UNICEF, and this was top of mind, we didn't actually provide a list. UNICEF and Red Cross came up top of mind, followed by World Vision, Doctors Without Borders, Oxfam, and then it decreases from there. And there were many organizations mentioned, but most of them weren't higher than 2%. As I mentioned earlier, we also asked about social media. Approximately a little over 9 in 10 Canadians are now actually online. It's about 95%, I would say. 9 in 10 Canadians are on social media, and 9 in 10 Canadians also say that they are consuming their news online. What is interesting that we asked about this year was, where are you getting your online news? 61% of the Canadian population say they get their online news and headlines through Facebook. That way surpasses any other social media in terms of obtaining news headlines. 19% say they're getting from Twitter, and 18% say they're getting from YouTube. So while we always think that a lot of people are actually on Twitter catching the news there, it's actually a very small proportion doing so, and I think it's an important point to remember. The majority of people are on Facebook. There's been a significant increase even in usage of Facebook from 2015 to 2017 as more people have joined on board. Specifically, grandmas. My grandmother has joined on board. So basically what I'm saying is that older Canadians have joined on board, which has increased the incidence of those who are actually on Facebook. An important point that we wanted to bring up was that it's also, keeping this in mind, it's good to keep Facebook in mind, expand the conversation beyond the sector, go beyond Twitter, go beyond the typical channels that you may use to communicate with those who are very interested in the sector already in order to engage broader Canadians, and use language that is less technical to the sector itself. So maternal child health does mean things to Canadians, but it has a broad number of meanings. We know this from other research we've done as well, that you need to be a little more specific about what you actually want to get across. So the final, I guess, one of the key points is just to speak with one voice in using the same language about the key issues surrounding women and children's health. And what I'll do now is I'll pass it over to Michael Mahoney.
Thanks so much, Grace. Hi, everyone. Thanks for joining us today. My name is Michael Mahoney. I'm a Director of Strategy at National Public Relations. I'm going to take you through some of the segmentations we developed with our belief-based behavior research. So this is an application of digital ethnographic research. We use a team of anthropologists to scour online communities to help understand what is happening in those online spaces. We're going to present 6 segmentations that we found online. Interesting that our original research a few years ago identified 4 segmentations, and along with the segmentations that Ipsos developed, we've merged those segments into 6 core segmentations that we believe are important for understanding how to engage with Canadians based on their value system. Really important to engage with Canadians based on their value system so that our message comes across and resonates with the right audiences. And there's some really interesting findings that came out of this that we'll get into after the segmentations are presented. So jumping right into the segmentations themselves, the first one is the socially conscious advocate. There's a key quote here that kind of captures the sentiment of this segment. The socially conscious advocate might be heard saying things online such as, we're a developed country and we can help others. There's a lot of pride within this segmentation of being from Canada and the value that we might add to the international community. However, they're often focused on initiatives within Canada's own marginalized communities. So they recognize the value of maternal and child health, but they tend to focus more inward. The majority of them believe that our efforts should be focused within Canada, and approximately 68% of them agreeing with that statement. They are confident, they're outgoing, and they do consider themselves leaders. So an important community for us to engage with. These advocates are super active on social media. We find them on Facebook and Twitter. We find them on other social networks as well. They're often going to these networks to find news and to engage with others. So next is the optimistic supporter. Like the socially conscious advocate, the optimistic supporters recognize the value of maternal and child health, and they believe that it's an important aspect for the government to invest in. Lots of them are interested in maternal and child health. They do believe the government should be focused in this area. The vast majority do feel that the government's not doing enough in this area right now. However, like the previous segment, they're often focused internally within Canada. They are confident, they're outgoing. They also consider themselves to be leaders, and they believe that people look to them for information, and they believe that they have a voice in this conversation. They're very active on social media, and it's important to engage with them in a really real, honest way in those communities. Key quote here, children are the future, and mothers need to have the most help so they can provide for their children. They really understand the impact that the mother has on developing individuals and the broader impact that that's going to have on communities, not just locally, but abroad. Mothers take care of children, children grow up to be well developed, everyone benefits from this situation. So they easily see the connection to that. Next, we have the conscientious pragmatists. They believe that maternal and children's health is a really worthy cause to support, but they don't necessarily believe that they can do a lot in this area. Key quote, I wanted to do World Vision, but I did something closer to home instead. This is an interesting sentiment we see mentioned quite frequently. They are interested in the issue of maternal and child health. They often believe that there are other priorities that need to be taken care of first, but they do believe that the government, in particular, has a strong role to support this area of development. Even if they themselves can't have an impact, they do believe that the government has a role to do so. So they do see the government making investments in this area. They do believe that that should continue, and some of them kind of balance between whether or not that money should be going abroad or whether or not that money should be helping communities at home. They understand the need to do both, and they're not quite sure what the balance or the right answer is. They'll really turn to experts to help make those decisions. They're very confident and outgoing. Not very many of them consider themselves to be community leaders, though. So they won't necessarily go into online communities and engage or advocate necessarily, but they will consume information. So next we have the Canada First Populist. It's a really interesting segment. Key quote here, I see so much need locally. Charity begins at home. I think we've all seen this belief system represented in the media quite frequently in the past couple of years. The interesting thing about this group is it's a very diverse group of individuals from across the country. They really believe that there is a lot that needs to be addressed in the world, and they're hopeful that that will be addressed. but they see the need for the government and for aid organizations to be focused domestically. And that's a key theme we see across a lot of these groups, this challenge to balance between the needs of our communities immediately at home and the needs of communities abroad. And that trade-off that some people feel between international aid and domestic development. Some of these segments really believe that it's an either-or situation. Other segments believe that there needs to be an effective balance found, and you can't ignore one while helping the other. This group in particular is really focused at home, though. They're not particularly engaged on issues of maternal and children's health, mostly because they believe that health outcomes in Canada as a developed nation have been pretty good over the last couple of years, and they feel that we need to focus on other problems first. So inequality, the environment, peace and security. These are issues that are going to be much more top of mind for this individual, like many of the segments actually. They do frequently access social networking sites. Many of them are not particularly active on those platforms, but they're definitely turning to them for a source of news and to keep in touch with or to keep their finger on the pulse of what's happening in the world around them. They do think Canada has a role to support and enable the forced populations, but again, mostly at home, and they don't necessarily see the value in sending $8 abroad. Some of them also believe that when we send $8 abroad, it's seen as a form of interference in international relations. And so an interesting challenge to engage this group, but we found through our ethnographic research that there are interesting ways that we might be able to bring this individual on side and see the connection with aid work abroad having an impact here at home. Now, the last segment we're going to present is a really interesting one. This segment was quite prevalent online, and that was the cynics. Now, the cynics are a really passionate group of individuals. We saw them in a lot of online forums and discussion groups. They would often hide their identity behind anonymous profiles. Sometimes they would be public, but this was a very outspoken group. Typically tend to be very educated. They're very well informed. Sometimes may display a one-sided perspective on particular issues that they're passionate about, but at the end of the day, extremely educated, extremely informed, and very in tune with what's going on with the world around them. Now, this segment in particular is really challenged by international aid questions. They understand that there's a need for this abroad, but they often see that aid projects from the Western world have more of a negative impact than a positive one abroad. So they'll use examples of Western interference in other governments where Western aid organizations are going into developing nations and imposing Western ideals or cultural values or norms on other countries. And they view this as a particularly bad way to engage with the international community that may do more harm than good. They'll often talk about examples of well-intentioned organizations even that end up having a negative impact abroad. So just to help bring this to life, an example that some of these cynics might share would be the example of Tom's shoes, where you buy a shoe and another shoe gets donated to a person in need in the developing world, but they'll point out to how in certain communities this type of model has actually impacted local shoemakers and their ability to make a living. So they see a negative or a downside to a lot of international aid development that hasn't necessarily taken the local cultural context into needs properly. Now they're very active online. They're very quick to share their opinions or information about these particular topics. Important to engage them in a proactive way that's respectful of the depth of knowledge that they have in these areas, and to help engage them in that conversation in a positive light. We say that because this group is very effective at organizing opposition online. So getting them engaged early, making sure they understand projects or programs, intended outcomes and successes, will help this individual understand and engage with us in a proactive and positive way that helps push us all forward. Because at the end of the day, that's a shared value that we have with this group. So that's it for the segmentation. I'm going to turn it over to Carolyn now to go over some of our recommendations.
Wonderful, thanks, Michael. So while we do end on a segment of the population that appears difficult to engage and be supportive of our message, we really believe that there are opportunities to engage. So what we want to do is, rather than focus on the more challenging issues, which we definitely feel there are certain challenges and there's a recognition of it, we want to look at a way forward and how do we propel the network and the amazing work that's being done collectively. How do we propel this so that Canadians are aligned with that vision? So our first recommendation is really connecting with Canadians on values in addition to facts. So Michael walked us through what those different belief systems are, and what we recognize is that facts are simply not going to be enough to get Canadians on board. We really need to remind Canadians that addressing women and children's health issues is a foundational contributor to global security, economic inequality, and environmental degradation. And what's key about that is really engaging Canadians in one voice and agree to common messaging and priorities that will connect with Canadians in real and intangible ways. While letting Canadians know about the full value of international development may not be realistic, we believe that small changes in the narrative can have a broader impact for investment abroad. So we've moved along to the second recommendation here, which is speaking and appealing to Canadian values and a desire for a better world. What we found through our research is that there is inherently this desire for Canadians to really see a much better world. They're overwhelmed with the negativity of the news, so they are looking for that positivity, and we need to provide that to them. Canadians expressed a strong interest in learning more about Canada's role abroad once they learned that we are leaders in women and children's health. And we simply feel that right now that's a narrative that is not being, while being communicated, may be told in language that is not being understood by the average Canadian. So we really need to make it easier for Canadians to engage in conversations and stories about that work. International development work and healthcare outcomes are often complex, they're often very technical, and these, again, are difficult conversations for Canadians to understand. As one of the network's pillars is public engagement, a first step is to address that language used to discuss maternal and child health currently discourages dialogue between professional and non-professional stakeholders. So if we look at the platforms that are most currently used, we see that Facebook is a really key channel to engage with Canadians, but we need to be cognizant of the language with which we are engaging Canadians through on those platforms. For example, terminology like RMNCH or Sustainable Development Goals really don't mean much to the average Canadian. So how do we tell those stories in ways that resonate with them so that they can understand what is happening abroad, and moreover, how does that amazing work translate to what is happening here in Canada? What does it mean for their security? What does it mean for their daily challenges? So to summarize that point, really consistent language and terminology is essential to ensure your collective communications are going to resonate with Canadians. So our next recommendation here is really creating a national framework for all partner organizations to use when engaging with Canadians. Canadians believe Canada is doing better than other countries in supporting issues related to women and children's health abroad. And Grace spoke to this earlier, but over the last year we've seen significant media attention around government announcements that highlight Canadian investments globally. We did a quick scan of media coverage and just some of the headlines that we've seen. For example, in January, there was a lot of media coverage about the Minister of International Development launching the new feminist international assistance policy in Ottawa. And while that didn't mean additional funding, if one was to simply look at the headlines, that is what you would come away with, unless you read the full article, where you would have understood the complexities of it, the fact that it wasn't additional funding. So that is a challenge that we need to overcome. Similarly, in March, there was an announcement that Canada's Liberals were going to help fill the global gap from Trump's ban, and there's a lot of coverage about it. So the good news is there is dialogue, there is interest. Media is covering this topic. However, we feel that there really is a key opportunity to change that narrative so that we also focus on the much needed funding. And that relates back to developing that cohesive language, the mission statement, really harnessing the power of the network to propel that message forward. And so you are best positioned to do that just because of the sheer numbers of your organization and the fact that you are all aiming toward a collective vision. Michael spoke about this. We need to acknowledge the realities that are faced by Indigenous women and children within Canada and look at ways to support these communities, recognizing that Canadians are concerned about what's happening in their backyard and they need to understand what is happening there. So looking for ways to address those concerns for Canadians globally as well. And our last recommendation here is really about leveraging national pride effectively. When they learn about work of Canadian aid organizations, Canadians are rightly proud of our nation. I think we alluded to that earlier, the Trudeau effect, the fact that Canadians are proud we're getting international coverage. I myself have had friends from around the world reaching out and saying how amazing it is that that our government is speaking up for women and children and filling in the gap that is being seen as a result of what's happening down south. But how do we leverage this opportunity in a country that's always hungering for a sense of national pride and identity? We really feel that this is an opportunity that can't be overlooked.
Michael, anything to add? While we can.
Yeah.
We'll be there forever.
Yeah, and really working as one sector to build that national support as you move together in this shared vision to positively impact the lives of women and children globally. And I think this report highlights the challenges that you recognize, that you work with daily to overcome, but with that comes great opportunity forward to how we propel that forward to our communications efforts.
That's it from us today. I hope everyone has a chance to download the report and ask any questions either today or in follow-up afterwards. Turning it back over to you, Charmaine.
Thank you, Michael. That concludes the formal portion of our presentation, and we'll move shortly into questions. Thank you, Grace, Carolyn, and Michael, and the other team members at Ipsos and National, and my fellow team members at CanWaCH who worked to deliver this report. We believe this work ensures that CanWaCH and its members are better positioned to come together and influence positive change, and we are better positioned to craft our public engagement strategy and activities going forward. Development of the CanWaCH Public Engagement Strategy and Implementation Plan will begin late this month in collaboration with our members. This strategy and plan will be presented at the CanWaCH Annual General Meeting on November 1st, 2017 in Ottawa. Please continue to consult canwatch.ca for details on the AGM. We will now invite webinar participants to ask questions of our presenters. We'll start with those joining us by phone. For those participating on your computers, you can type your questions into the chat box and we will answer them in the order submitted. Is there anyone on the phone with questions? So I think we'll just jump to the chat pane for written questions. Our first question is, how does the Canadian public view the role of the private sector in maternal child health?
I'll jump in from our perspective, and then it'd be good to hear from Grace as well. We wouldn't say that we saw a lot of engagement from Canadians on that particular issue. So most of the conversations that we saw taking place online and most of the forums were really focused on the government's role and the NGO community. What is that role that they have in development? And we didn't see a lot of engagement in the private sector in terms of for-profit organizations and what impact they might have. But Canadians in general don't always make a distinction between NGOs that are working abroad, governments that is funding NGOs to work abroad, and private sector organizations that are working abroad in this area. So most Canadians, it's just one group of individuals working on particular issues. Grace, anything else you'd like to add to that?
No, I think you summed it up really well. I think Canadians just generally think of overseas development aid and support as one broad thing, and they can't distinguish necessarily between government, private, and not-for-profit. So I think you made a really good point here.
Well, thank you very much for that answer. Moving on to our next question. What are some strategies to better engage men in supporting women and children's health?
All right, I'll jump in first as a guy. This is a really great question, and we spent a lot of time looking at the difference between men and women and how they engage on this topic online. Some really interesting nuances came out of that. At the end of the day, though, it's pretty simple. We all understand that we have a stake in this, men or women. And most men who were engaged and proactive on this discussion were tying it back to, well, what would I think of this issue if it was my family, my mother, my daughter, my wife? Any way that you can make men understand that, put them in the shoes of someone going through particular issues, understand how they would want the world to engage with their family, helps them understand that. I think women intuitively understand these issues maybe a little bit better than men do. Men need a little bit of a connection to be drawn, but once they do, they're very fast and strong.
Yes, so I also agree with what Michael said, that when men are engaged, they are very engaged. It's also important that when providing information that or messaging, that you have facts included, because men glom on to some of the fact-based information. What was spent and how was it spent, and what were the results from that funding. So I think it's also important to keep that in mind in the messaging.
So moving on to our next question. We are curious if you can give us some tips on appropriate terminology to use.
First, I guess one of the things that we do want to address is that as one of the key steps moving forward, I think that is a priority for the public engagement working group to really help to develop that language that can be used and accessible for all. As just an overall tip, I think one key thing to do would be when you are developing any public-facing messaging, the tip would be run it by a neighbor, run it by a friend, be somebody that is not involved in the sector, that may not have, doesn't live and breathe it like you do daily, and see if they understand what you're trying to get across. And I think that's a very simple and effective way of seeing if your message is being communicated.
And as a good follow-up to that question, you mentioned that Facebook is the forum to reach Canadians. Do you have any examples of a good Facebook post?
Sure. So I think one of the things that we do want to address is that as one of the key steps moving forward, I think that is a priority for the public engagement working group to really help to develop that language that can be used and accessible for all. As just an overall tip, I think one key thing to do would be when you are developing any public-facing messaging, the tip would be run it by a neighbor, run it by a friend, be somebody that is not involved in the sector, that may not have, doesn't live and breathe it like you do daily, and see if they understand what you're trying to get across. And I think that's a very simple and effective way of seeing if your message is being communicated.
And as a good follow-up to that question, you mentioned that Facebook is the forum to reach Canadians.
I don't have any specific examples off the top of my head, but there are definitely positive ways and less effective ways, let's say. Generally with Facebook, the more you can help someone, the better the language you use, the more selective you are in making sure that an average person can understand the post, and you're not using technical terminology that's common to how you might talk to a coworker who understands these issues, the better that message is going to be able to spread online. Even if your first initial audience on Facebook is someone who does understand the issue and they may engage with it, if they were to share or comment that post, is the next level in their network going to understand that issue if they haven't been following your Facebook page for some time? So that common language, think about writing at a 4th or a 6th grade level to explain issues, but also relating it back to what does this mean back at home? What is the real core problem that we're trying to solve? Not just that a certain outcome has been reached, but why is that outcome important, and helping to be clear about why people should care about this. Sometimes they just want someone to connect the dots for them, make it easy for them to understand and know exactly what they need to know, what it means for them, and if there's a follow-up, what do they need to do next.
And to add to what Michael's saying, language, of course, is key, but you also want to make it visual, making sure that you're putting photos that really capture people's attention, and positivity goes a long way. Again, going back to all the negativity that we see, people gravitate towards positive issues. So not only focusing on the challenges, but actually the outcomes, the positive outcomes, the results of the work is key.
I see an interesting question. I'm just going to jump on here from Helen. Strategies to mitigate the damage of the cynics. It's a really good question. Cynics can bring an element of negativity to a conversation, but I think it's important that we recognize where are they coming from. What is the perspective that they bring to that conversation, and being respectful of that. It's really easy to become dismissive, to think that they're not adding anything of value, that they're just trying to be negative. But in many cases, they're really trying to find answers themselves. And to understand that we all have a common stake in this, and to engage with them in that honest fashion. It's really important also to think carefully when responding to anyone online. There's a difference between a cynic who is hungry for information, who doesn't necessarily understand the full impact of something, or believes very strongly in a particular side of an issue. There's a very big difference between that person who honestly does want to engage and an online troll who just wants to derail conversation. And sometimes their behaviors look very similar. However, as you engage with them, it can become apparent who's actually interested in an honest dialogue and who's interested in stirring the pot. And once we know if it's someone who's just stirring the pot, it's time to back away and to not engage with that group. But if it is someone who's interested in an honest dialogue, bringing them in, showing them respect, goes a long way to making them feel heard and included.
So another great social media question here. How do we optimize Twitter even if it is less used? And they would also like to understand how to target millennials whom they believe to use Facebook less.
So a two-parter here, and I'll break it into two pieces. So first of all, Twitter is still a very important platform for a number of reasons. But first of all, foremost, think about Twitter as a strong way to engage people in your own network, people who are closer to the issues, and to have those high-level conversations. Twitter may not be the best place to have conversations with the average Canadian who's not directly working on these particular issues. That being said, always using the right keywords so that your conversations on Twitter are showing up in the right search terms could be key to help breaking through that professional network and reaching a broader segment. So we think that there is opportunity. Unfortunately, to be honest, over time, Twitter is likely to become less and less relevant to the average person and to become more and more of a focused professional community. But it is still incredibly important to utilize Twitter effectively to engage with other coworkers, other people across your sector, and in particular, the media, especially media who may be interested in what your organizations are doing. Twitter is a key avenue to get word across, especially in between major announcements, but to keep that engagement with the media and maybe the policy sector as well. The second part of your question about Facebook, this is an interesting question, and we get asked this a lot. The truth is it's really a myth that millennials are not using Facebook. Millennials are on Facebook en masse. Yes, they do often engage more with things like Instagram or with Snapchat, but even Snapchat has seen massive loss in users recently. Instagram has high engagement. I am a millennial. I check my Facebook posts much more than I check Instagram every day. While I may not engage with Facebook the same way I did 5, 6, 8 years ago, I still go to Facebook for my news. I still go to Facebook to keep on top of major issues and topics. I still go to Facebook to send a message to friends because I don't remember their phone number. And that's how we get in touch. Facebook is always going to be important for the near future, but think about Facebook now more like plumbing. It's an essential part of communication. It's not necessarily the coffee shop where you go to have the conversation, but it's where you go to be kept up to date. It's where you go to engage with close friends, and it's where you go to maintain those softer networks. It's still going to be very important. And again, millennials are using Facebook. They're using it in vast numbers, and we don't see that changing in the near future. Grace, anything you want to add to that from a statistical perspective on?
Sure. Is it true, Michael, that younger users are active on Facebook, but they're not, I would say that they're passively active. They don't necessarily post as much as they used to. They're just reading it, reading what their newsfeed is saying more often now. In terms of reaching millennials, I mean, I think the key point, if you just go back to the general population, is that awareness of this issue is still relatively low. There's 4 in 10 Canadians who are aware of the general issue itself. So targeting millennials, in terms of other digital ads that I've tested for other types of clients, including health, typically, even if our ads are targeted towards older, generations 35 and older, 18 to 34-year-olds are still more likely to recall the ads. And it's likely because they're going through their newsfeed more often, more frequently, daily, on a daily basis. They're more likely to notice ads. They're more likely to catch on to what they're seeing as well. It's also important, I think, to not forget the story and the narrative in telling. Carolyn mentioned this earlier about the narrative, but identifying what that need is in terms of raising awareness. Some people just don't know what is happening globally with regard to maternal and child health or women and children's health. So just raising that general level of awareness overall, you'll certainly capture the 18 to 34-year-old group simply because they're online more often. It's a broad answer, but I would have to say to really learn exactly what triggers them, we might need to do more focus groups in this area.
Thank you for that great answer. Unfortunately, our time is up. I would like to once again thank Grace, Carolyn, and Michael for delivering a very informative presentation. And I would like to thank all of our participants for joining us today. CanWaCH looks forward to offering our members many more webinars in the near future. Thank you and have a great rest of your day.